Hello, and welcome to our Reversing Insulin Resistance Webinar. My name is Denise, and I am the founder of Essential Wellness. This webinar is part of our How Not to Die Plant Strong program. Today, we have 4 plant-based medical professionals who will speak on how to manage insulin resistance using a plant-based way of eating. Our first speaker is Dr. Mackay, a plant-based general practitioner from Melbourne, Australia. Dr. Mackay has more than 40 years of experience eating plant-based and helping others to eat plant-based as well. Welcome, Malcolm.
Thank you, Denise. Thank you for the introduction. I'm Malcolm Mackay. I'm a medical doctor. I'm a GP practicing here down in Melbourne. I also provide telehealth, but my license restricts me to only treating people who are in Australia at the time of consultation. My Whole Foods plant-based journey actually goes back a very long way, right back to medical school. There's a lot of public literature, a lot of published literature that should have really made it obvious to everyone that that many of our chronic diseases were caused by the food we eat, by the lifestyle we have. And when I started to look at the risk factors for heart disease, the sort of dietary patterns, they're the same as many of those for cancers, the same as those for diabetes. When I finished medical school, I realized that there's almost no nutrition in medical school. So I went back to university and got a graduate diploma in nutrition. In more recent years, I've completed a board certification in lifestyle medicine. Lifestyle medicine is, the application of all the healthy lifestyle behaviors, the stress management, the physical activity, sleep, etc. But I think that nutrition is the keystone of the lifestyle factors that influence our health, and that's what today's presentation is going to focus on. As Denise said, Jenny and I, Team Malcolm and Jenny, we normally put on one-day seminars, but we've changed them into a 4-part webinar series that we do one of these, have been doing one every month during COVID times. And as soon as we're unlocked and allowed to hold an event again, we'll start holding our 6-day live-in events at Anglesey again, down here in Victoria, near Melbourne. I think at this point I'll start my presentation. Thank you, Jenny, for the IT assistance. So I'm going to be talking about really diabetes and looking at it as actually treating the cause. The standard medical treatment of diabetes, and I'm mainly focused on type 2, and if you've got type 1, don't be offended when I just say diabetes. The focus in medicine is really on early detection and early treatment. Diet advice is usually limited to just weight loss and maybe even reducing carbohydrates. We expect the disease to gradually progress, and so we anticipate that there'll be a gradual escalation of the drugs that we use to treat someone's diabetes. And we also, there are other diseases usually associated with it, like high blood pressure, high cholesterol, and so there's usually other drugs as well, and you might end up on 3 diabetes drugs, a couple of blood pressure drugs, a blood thinning drug, a cholesterol lowering tablet, etc. But nonetheless, the disease is expected to worsen over time and never get better. And the drugs, some of them work, like, they reduce the complications, make it less likely to go blind or have your leg cut off or have a heart attack. But they don't stop the progression. There's another dangerous trend in medicine here in Australia, and that is to recommend a low carbohydrate diet, usually based on meat and high-fat dairy foods and oils, the very foods that were the problem to start with. And if you do that, you'll get an improvement in blood sugar by cutting out the carbohydrates. But in the long term, you'll get an increase in chronic disease and an increase in death rate. So, when it's a lifestyle disease, and so a lifestyle disease really needs a lifestyle treatment. And Dean Ornish makes the analogy, it's like mopping up around an overflowing sink without turning off the tap, where the mops are our pills and procedures, and the tap is the flow of meat, dairy, processed food, etc. And when we use drugs to treat a chronic disease, we use individual drugs to inhibit each, a particular physiological process, like to block some normal enzyme in the body. And sometimes this will reduce the complications of the disease, but not really the progression. And it won't completely stop the risks. And of course, when you use drugs like this, there are always side effects. If you prescribe a cholesterol tablet, you increase the diabetes risk, for example. But using food as medicine, we've got different general principles. First one is that we're trying to treat the cause, not the measurements, not the biomarkers or the symptoms. And we're using food, we consider the food to have, let's say, a symphony of nutrients working on a multitude of mechanisms to enhance normal function, rather than a pharmaceutical just trying to block one particular biochemical step. And when we use food as medicine, there's a breadth of effect. That is, the same diet that will help diabetes will also reduce your cancer risk. And the side benefits, like weight loss, rather than side effects. And the diet prescription is more holistic rather than reductionist. If there's a super anything, it's not a superfood, a super nutrient, it's a super diet. And the issue of personalization is overstated. There are only minor differences required for different individuals. And as the person gets better, we deprescribe their medications. So type 2 diabetes starts with insulin resistance. And this is really important to understand. This is the core of diabetes. And here we have a picture of a cell, like it's probably a muscle cell. That's sort of a good part of the mass of the body. And when we eat carbohydrate foods, this glucose comes along in the blood. And it's, it's not a bad thing. It's sort of like our human body's main sort of energy currency, our oil pipeline, our electricity supply, if you like. And it comes along, and the body's very careful what it does with it. And to get into a cell like the muscle cell, to be stored like a battery for later use, the insulin has to come along and unlock the door and let it into the cell. And this is all very fine. So the body makes a bit of insulin, where the glucose goes up a bit after the meal, the body makes a bit of insulin, the glucose goes into the cell, so the glucose goes back down again. And then between meals, I guess the body will sort of turn down the insulin so that the blood sugar is maintained for things like brain function. But what happens in type 2 diabetes is that the cell becomes full of these globules, intramyocellular lipid, or in plain terms, fat in the muscle cell. And the fat in the cell interferes with the chemical steps by which the insulin unlocks the door and lets glucose in. No worries, says the body. That's not a problem. The body can make twice as much insulin, maybe 4 times as much. So it just ramps up the insulin production and sort of wedges the door open, and the process can keep going and the blood sugar can be kept under control until eventually the body can't make any more insulin. And then the blood glucose rises to unhealthy high levels. And at that point, you have diabetes. Where does this fat come from in the muscle cell, in the liver cell for that matter as well? It comes from the fat we eat and the fat we wear, particularly the saturated fats. Think of animal products for saturated fats and some of the other fats like coconut fats and palm oil, processed fats, etc. And the fat we wear, our body fat, is always spilling back into the blood again. So that can also contribute. This process of insulin resistance, this is entirely reversible. And some of you might be looking at this and thinking, well, I don't have diabetes. Many of us have insulin resistance. This little diagram here shows the pancreas, and those beta cells make insulin, go to this muscle cell, for example, unlocks the door for glucose. And the pancreas always makes a bit of insulin, but it releases more insulin when the blood sugar goes up, or for that matter, when some more protein comes along. It's also got a little trick that it can release insulin even before the blood sugar goes up, because the gut makes all these hormones and sends messages to the pancreas, to the beta cells, saying, hey, look, there's some food on the way, start making insulin. These beta cells are are quite susceptible to damage. Type 1 diabetes is when you lose them. They all die because you get an autoimmune disease. You make antibodies to them. There's also, just like you can get fat in the muscle cell, fat in the liver cell, you can get fat in the building up in the beta cell as well, and that damages them. And there are many things in meat, eggs, animal products, I guess some of the processed plant foods, that actually are somewhat toxic to the beta cells. That includes the heme iron in meat, AGEs, other components. The other thing that happens is with the diabetes and the body trying to make more and more and more insulin to squeeze open those glucose doors, eventually these beta cells burn out. So that's another factor. And as Peter alluded to, when you have type 2 diabetes, you actually gradually destroy your beta cells. And then we could say that you've got type 1.5 diabetes. That is, it's all about insulin resistance, but there's also some reduced insulin production. If this state's going to be reversible, you have to really ramp down that insulin resistance. The benefits of reducing insulin resistance is that in early type 2 diabetes, you can actually get remission. And if it goes away for several years, we call it sustained remission. At that point, you're pretty much cured. I think about 80% of people in the first 4 years of having diabetes can potentially be reversed. Smaller percentages of people who've had it for years because of the damage to the pancreas. But there are many cases of people individual cases of people who've had diabetes for, a decade or two, who managed to reverse it. And diabetes reversal is now accepted in medicine. It sort of became accepted because, we did bariatric surgery and cut out part of people's intestines and they lost masses of weight. But now it's been shown to happen with diet alone, and particularly plant-based diets. You can also get remission of gestational diabetes. Pregnancy is like a bit of a test for how good your blood sugar control and insulin is. And if you've got type 1 diabetes where you can't make any insulin, if you unclog the system, then your injectable insulin will work much better and your levels will be more stable. And insulin is not an evil hormone, but if insulin levels are really high, it increases cancer risk, increases heart risk and cholesterol, and leads to more fat storage around the body. So the diabetes medications, just flicking through them to say what they do. Metformin reduces insulin resistance, but it tends to have gut side effects like diarrhea and nausea. Then there's the SGLT2 inhibitors. These are relatively new. These basically make you pee out the blood sugar. I mean, to me, it's sort of a bit like an eating disorder where you vomit out the food, except in this case, the food goes into yourself and then you take a drug to pee it out. And of course, this is going to have problems with the genitourinary system, having all that glucose coming out in the urine. Then there's the sulfonylureas that have been around for years. And they stimulate insulin release, whether you need it or not, and they tend to cause low blood sugar. And they may not actually improve long-term outcomes, even though they improve blood sugar control. Then there's a whole host of these other drugs with curious sets of letters, like the glitazones and the DPP4 inhibitors, and now the GLP-1 agonists, which are usually injections, daily or weekly. These drugs, this is interesting because remember I said that the pancreas detects food before it comes in, like the gut hormones tell the pancreas to make insulin. All of these drugs in here tend to work on those systems and stimulate insulin release through the gut hormones, less likely to cause low blood sugar reactions. And then, of course, there's insulin itself. You just keep putting more and more insulin and wedging those doors open more and more for the glucose. Note that only one of these drugs, metformin, actually sort of gets towards the cause of type 2 diabetes, of insulin resistance. And you will have heard Peter mention the HbA1c. That's a measure of how much sugar gets stuck to your hemoglobin in your blood. So it's a measure of how much and how high and how often your blood glucose has been high in the previous 3 months. And this scale ranges from down the bottom, and I'm not sure which scale to use in the US. So this is the percent numbers, but we're just changing to a metric number in Australia. So I put both scales there. And a normal range is sort of 5 to 5.5 or so. Really healthy, lean and fit people have a HbA1c that's usually a little bit below that. Mine's a little bit below that. Even though I'm 61, I'm quite lean and I do quite a lot of exercise, so mine's under that level. Pre-diabetes is sort of above 5.7, but by the time you're getting up to 5.5, 6, you probably already showing signs of insulin resistance. And by the time you hit pre-diabetes, you've already got an increased risk of heart disease. And as Peter said, you're already losing beta cells. And then you hit that 6.5 or thereabouts approximately, and you've got diabetes. And when you get diabetes, we want to sort of keep it, you know, at in this range here, because if you have poorly controlled diabetes, and I've seen these measurements at, you know, 12, 13, then you have a very high risk of complications, like, you know, you're likely to go blind or something terrible happened to you over the years. So, as I said, we're trying to treat the cause more than the symptoms. And when you do a low carbohydrate diet, you reduce the blood sugar levels, but it's a bit like restricting fluid intake because the toilet's blocked. It doesn't actually fix the problem. Whole foods plant-based diet will actually reverse the underlying insulin resistance, so more getting down to the cause. A high carbohydrate diet, though, I mean, this is a high carbohydrate diet. Would this really work? Well, Neil Barnard, who's pictured here in his book, Reversing Diabetes, he carried out a more than 1 year clinical trial, and he compared a low-fat vegan diet, not just with the American diet, but with the best American Diabetes Association diet. And despite being very high in carbohydrates, his low-fat vegan diet got better results than the previous in the standard gold diet. However, as Peter alluded to, people with diabetes don't usually die of high and low blood sugar, they die of heart disease. So a diabetes diet must also protect against heart disease. Like, don't give me a high animal fat, high meat diet for diabetes. That's going to be terrible. They're going to die of heart disease. And diabetes also leads to kidney failure. And so the diet must protect against that as well. And animal protein causes quite a lot of damage to the kidneys. The good news is heart disease can be reversed. This was shown by Dean Ornish, and down here in this picture is Caldwell Esselstyn with his book, Prevent and Reverse Heart Disease. We went to a workshop with Caldwell and Anne Esselstyn last September, and we can say quite clearly that the only diet that's been shown to actually reverse heart disease is a low-fat, whole foods, plant-based diet. Here are some heart disease risk factors, and they're different colours sort of indicate different underlying mechanisms. And we've got the standard ones, you know, we give people tablets for blood pressure and tablets for cholesterol and diabetes, and then there's smoking. But there's a whole lot of non-traditional risk factors like inflammation, TMAO, heme iron, animal protein, and of course other lifestyle factors. As I said, I'm a lifestyle medicine practitioner, not just a nutrition practitioner. Drugs can't treat all of these. Drugs only partly treat a small number of these. But most of these risk factors are increased, made worse by animal products and processed food, and improved by whole plant foods. Oh, I mean, provided you don't smoke the plants. And some of the underlying mechanisms, you know, food works through many of these sort of body balance mechanisms that the body keeps in balance, that sort of for good health, including the gut microbiome and immune. Even the regulation of genes is altered by what you eat. And most diseases are actually involve more than one mechanism, and that includes heart disease and includes diabetes. So when we eat plants, the plant-based nutrition has such a powerful therapeutic effect because of this symphony of nutrients working on all of these different mechanisms versus you pharmaceuticals, which are just trying to inhibit one process. And whole foods plant-based nutrition has a wide breadth of effect because the same diet that's going to help diabetes will also prevent cancer, help you to lose weight, protect the kidneys. And notice I've been saying whole. The whole in whole foods is really important when you eat whole plant foods, more or less, as grown with minimal processing, they contain just the right balance of vitamins and minerals, just the right balance of protective phytonutrients, and they're packaged in a matrix of dietary fiber. You could never replicate this in a food factory. Um, and the nutrition of whole foods is infinitely complex. You've not only got the dozens of nutrients, but you've actually got thousands of biologically active other substances in food. But fortunately, with this complexity, there's a fairly simple solution, and that's eat whole plant foods and don't try and outsmart nature with artificial foods and supplements. Someone in the questions mentioned the gut, and yeah, the gut microbiome does play a role in diabetes, quite a big role. Um, of course, whole plant foods feed those microbes down in the colon that sort of represent, the latter half of our digestive system. And when we eat high fiber and starchy foods in the unprocessed state, these microbes get a feast of substances that they turn into short chain fatty acids. And these short chain fatty acids have effects like they go to the liver and they improve blood sugar control. They even regulate our appetite center in our brain. And they have effects that keep our heart and brain in good health. Whereas when you're eating meat, things like meat and eggs, for example, you'll feed the bad microbes. You'll increase the inflammation. For example, there's a substance in meat and eggs that the gut microbiome turns into TMAO, which is a newly discovered risk factor artery toxin. So and someone asked the question about fecal microbiological transplants, poo transplants, to try and give you a better microbiome when you're diabetic, to try and give one that's going to better support your blood sugar control. The flaw in this is that the gut microbiome, the type of microbes you have there are determined by the type of food you eat. There's research showing that it only takes about 3 days of a particular diet to completely transform the microbiome. So forget about getting poo transplants and just eat the right sort of foods to support the right kind of gut microbes. And don't go on a low carbohydrate diet because these cut off the fuel for healthy gut microbes. Being overweight is just not healthy. I know it's quite a sensitive issue here in Australia for some people, but I feel like I need to tell the truth on this. Being overweight damages your health through multiple mechanisms. There's no way to be overweight and healthy. I'm sorry to tell people this, but it is what it is. It's human biology. When you have an excess of body fat, it actually releases inflammatory mediators into the blood. It pours fats back into the blood. And this worsens blood sugar control, promotes heart disease, and increases cancer risk. Even small amounts of visceral fat inside the abdomen, that little pot belly, can cause insulin resistance and high cholesterol. Really, to prevent and reverse diabetes and to prevent heart disease, we need to be lean, like our ancestors. So sort of some of the desirable characteristics for a sort of optimal diet for diabetes prevention, treatment and reversal would be no animal products, very low in fat, particularly saturated fats, very high in fiber, rich in anti-inflammatory, antioxidant plant nutrients, low in calorie density, and where the grains and other carbohydrate foods are not finely ground, are in their minimally processed state. Jenny's presentation will go into this in more detail. And don't forget exercise. This is a really important part of it. I'm a lifestyle medicine practitioner. There's me running and there's Jenny swimming a few weeks ago. Deprescribing is the process by which we gradually reduce and stop medications as the patient gets better. A lot of doctors haven't had much experience with this because our patients just tend to gradually get worse and worse year by year. But when you remove the cause, the medications can become too strong for the patient. They can effectively overdose them because they don't need such strong medicine anymore. The reduced need for insulin can happen within days. I've seen it at our live-in immersion events where even though we'd reduced the gentleman's insulin, by the second morning at yoga, he was starting to go pale and shaky, and we had to reduce his insulin down to about a third to a half of what it was when he arrived. Blood pressure, maybe a bit more slowly, probably a couple of weeks, but the full benefits of blood sugar control, blood cholesterol, diabetes control may not really come into play until you lose the excess weight and probably for some people to increase their exercise as well. When deprescribing, I wait until I see improvements in the measurements and then I do the deprescribing. And then when I come to do that, I reduce the medicine in small steps. If you're on 3 medicines for blood pressure, I might stop one of them. Or if you're on a strong tablet for diabetes, I might reduce the strength. Medical supervision is recommended for most medication changes. Should I stop this particular drug? You may wish to know. And again, I've said I advise medical supervision, but what about insulin? Yeah, look, sometimes you need a dose reduction. A lot of diabetics will regulate their own insulin to some extent, and you may need to reduce the dose quite quickly when you do a full diet transition. And it would be safer to run at a slightly higher to let your blood sugar run slightly higher than to risk having low blood sugar reactions. Sulfonylurea drugs, they're a tablet that has a bit of risk because they can cause hypos, and you probably should stop these if you start to get low blood sugars. Metformin, as I said, can often cause nausea, pain, diarrhea. If that's the case, I think you should stop it. Lifestyle's much stronger effect than metformin. Then there's a whole host of other diabetes and tablets and injections. And again, I'll be doing a stepwise reduction under medical supervision. Blood pressure tablets, again, I'd be doing this under supervision. You don't want to be running with a really high blood pressure. You could have a nasty stroke. It's very often useful to do home blood pressure measurements. So you can front up to your doctor and say, here's the measurements I've had over the last few weeks or the last month. Can I reduce my blood pressure tablets? In regard to cholesterol tablets, yeah, it would do no. I mean, I usually take the stepwise reduction as cholesterol improves. But, if you just suddenly stopped your cholesterol tablet, there's not going to be any short-term harm. The cholesterol is a long-term risk. But don't come back a month later with a cholesterol test to me and all alarmed because your cholesterol was higher because you stopped your tablet. If your doctor won't consider reducing your medications as your pressure improves, your cholesterol, your blood sugar, then I recommend finding another doctor. So how whole foods plant-based do you need to be? How closely do you need to stick to this to your diabetes? I ask you to turn the question back on you. How healthy do you really want to be? And to put it into a social perspective, how important is your health relative to other competing lifestyle choices, like being able to eat out, fitting in with family members? And are you just using nutrition to stay healthy, or are you trying to actually reverse established disease? And then one has to consider where you've got to. Does your lifestyle and your past leave you with many health credits, or do you already have heart disease? Have you already smoked cigarettes or eaten fatty foods for many years? In which case, you're in a health debt. So how whole foods plant-based do you need to be? Well, it's up to you how whole foods plant-based you are, but you may need a high level of dietary adherence to get the full benefits and to ensure against future adverse health events. Thank you. This is just a little snippet in this picture of from our website, Whole Foods Plant-Based Health. And we've got sections on different conditions like diabetes. And thanks to my partner, Jenny, with her previous life as a research support librarian, there's a plethora of resources on that website. I can be contacted or we can be contacted via either of these websites.
It was very good of you to point out that we get to have a choice, Malcolm, about how healthy do we want to be? What level of health do we want? It puts the power back in our in our hands, doesn't it?
Yeah, it's
Yeah.
both the good news and the bad news. And you know, I'm realistic about it. Like, you know, there might be other competing factors in our lifestyle. Like it might not be totally, our life might not totally be about our health and medical conditions.
Mm.
You know, and we often bring up this issue of perfection versus progress. That is, you know, if it seems too hard, sometimes people just give up, you know, and go right off track. Whereas I think if you know, I guess my point here is that because it gets better results, I'd sort of be aiming for perfection as sort of the goal, but then because that might sometimes be too hard, one needs to make like the best food choices that you can under the circumstances. Like, for
Yeah.
example, if I go out somewhere and I can only get white rice, then I'll eat white rice. But I won't if I can't get, you know, brown rice and exactly what I want. I won't just give up and have you know, deep fried chicken. I'll I'll try and make the best choice I can in that situation.
Mhm. Mhm. We hope that you have enjoyed this video. If you would like to know more about reversing disease through using a plant-based way of eating, please either scan the QR code or send us an email. We love to help others eat healthy through eating plant-based. Ciao!